Hi everyone, and welcome to Kaplan NCLEX Prep. My name is Roberta Harbison, and I will be with you for the next hour answering your questions about the NCLEX exam. While we're waiting for people to gather, let me tell you a little bit about myself. I've been a nurse probably for longer than most of you have been alive. I've been a nurse for almost 40 years. I have enjoyed being a nurse. It's a really rewarding career. I've done a lot of different things, but my heart is in med-surg nursing. And I know that that's not popular as a specialty, but you know what? Med-surg, you can be a generalist in med-surg. You have a little bit of everything. You always have a challenge, and you have to be a good time manager to be a good med-surg nurse. And that's something that is also challenging. So I've been in med-surg almost my whole career. I was in oncology for a while. When my kids were young, I worked on a telemetry unit. And the good thing about nursing is there's so many things to do. There's so many different jobs you can have. The flexibility of schedules is wonderful. It's just a great career that I have never had a regret that I put in the hard work and did it. Along with my clinical experience, I've also, for about the last 15 years, been a faculty member. I've taught in practical nursing programs in California. I've taught in associate degree and bachelor's degree programs for RNs, and I've been with Kaplan for almost 10 years. When I worked in nursing schools, I used a lot of different NCLEX prep products, and I loved Kaplan the best, and that's why I went to work for Kaplan. So let's answer your questions so that you can also have that RN or LPN, LVN after your name, and we can get you on the road to success. So, Honey, that's great to know. Honey says that she passed the NCLEX along with Kaplan. So we're glad that you joined us, and we're glad that you had such great results. There's somebody here from Canada. So that's great because now Canada takes the same exam as everyone in the United States. And you might have some questions about the differences and how that works. And there are some, and we can talk about them. Okay, Brianna says that she took her NCLEX today. All right, so she's got to wait. This is the hard part, waiting to hear if all her hard work paid off. And so we will think good, positive things for you, Brianna, and hope that you had a good outcome and you can have those letters behind your name. Cassie, practical nursing. Yeah, we're all about nursing in general. So we have programs at Kaplan for practical nursing preparation for NCLEX as well as RN. So check out our programs for practical nurses too. Okay, I'm not going to try this name, but I just want to ask if California and New York have higher passing rates for the NCLEX exam compared to other states and territories. You know what? It really, it's not, it's totally up to the states where their passing rates are. So that's a question not for Kaplan, but it's a question for your state boards. Okay, so if you want to practice in California or you want to practice in New York, you need to contact that particular state board. In a related question to that, you should know that certain states have what we call a compact or a reciprocity, that if you take an exam in one state, it automatically transfers to other states if you want to practice in those states. So again, that's not true across the board, but that information is on the National Council's website and in the State Board of Nursing. Okay, so you might say, what's the National Council's website? The National Council of State Boards of Nursing are the people that administer the test, all right? They're also the ones that write the exam questions and for you. So those are the ones that, if you have a problem, those are the people that you can, throw things at or get frustrated at or whatever. But the bottom line is they write the questions, they call the shots, they make the rules. And so they have a website. So I'll answer any question here tonight, but if you forget what I say or you have another question after we're finished, all you have to do is go to their website. And it's National Council State Boards of Nursing. It's NSCBN, all right? National Council State Boards of Nursing, so ncsbn.org, all right? Everything you could possibly want to know about the NCLEX exam, and probably a whole lot you don't want to know or don't need to know, is on that website. So get familiar with it before you take your test. And you know what? A lot of what you need to deal with when you're taking the NCLEX is anxiety. And if you're the kind of person that the more you know about something, the lower your anxiety is, that's the website for you. Okay, so National Council, they're the people that administer the test, so go right to the horse's mouth, find out what they say about the NCLEX. There's lots there for you to absorb and to know. And if it decreases your anxiety a little bit, that's a good thing. Okay, so we have people from Puerto Rico here. Okay, how much time do you think it's appropriate for foreign nurses to study before scheduling the NCLEX? Well, I'm going to say it depends, right? First of all, how good is your command of English? Have you been in the United States? Have you worked in a hospital in the United States? If so, you're more used to how we do things here. If you're from a foreign country and you're trying to get to the United States and you haven't been here, you have no experience in health care facilities in the United States, it's going to take you a little longer. One thing that Kaplan has is we have a complete review course, both for PNs and for RNs, but we also have a course specifically designed for international students. And it is comprised of everything that our normal review courses are comprised of, but some extra things. We have some seminars about nursing in the United States and how they may be different from where you went to nursing school. We have extra content resources to review, for you to understand the nursing content as it's taught in the United States. I also believe there's a dosage and calculation kind of workshop if you've never had to calculate medication dosages. So if you are an international student, foreign nurse, I would really suggest looking into that course. There's a lot of things that are extra to help you. All right, so if you need me to answer anything more specific, I'm willing to do that. Just put it in the chat. But I would definitely look into that, especially if you haven't practiced in the United States and you're trying to pass this exam. Okay, we have somebody from Las Vegas. Does Kaplan have an NCLEX prediction test? Okay, that's a good question. We don't have a prediction test per se that's going to tell you if you get this percentage on a test, you're going to pass the exam, or you're going to have a percentage of you're definitely going to pass or you're not going to pass. our course material, our questions that we've developed are not predictive. And you know why? Because we can't control how you use those questions. In our courses, we can tell you this is what you need to do, but we don't have any control over whether you actually do it or you decide to do it, you use the resources your own way or whatever. So we can't say for sure whether you're going to pass or not. What we do have is we have target scores that we would like you to work towards, but we also have a new product that was just released on September 5th, and it's the CAT test, and it's the Computer Adaptive Test. And that product is brand new. It's an exciting product, which we are happy to offer, and it's just like the NCLEX because it works just like the NCLEX. The NCLEX works where you answer a question. If you get that question correct, it gives you a little harder question. If you get that question wrong, it gives you a little easier question. And what the computer does, it's trying to find your level of competency. Where are you comfortable answering a certain level of difficulty question? Now, if that level of competency is above what they say is the passing line, then you pass the test. If it's not, you don't pass the test. So all of Kaplan's questions and a lot of other review questions that you take, whether it's in a book or online or whatever, they're not computer adaptive. But Kaplan has developed a test that allows that to work. Okay, and so that's the closest thing we can get to predicting for you. And you basically predict yourself. To find out more information about our CAT exam, then go to our website at kaplannursing.com and there'll be information. Or you can call our customer service number. It's 1-800-527-8378 or 1-800-CAP-TEST, KAPTEST. You can find out more information, okay, about that exam. Because students have been asking for that for a long time. It was a long time developing, but we're excited that we have that product to help you to have that computer adaptive experience. How soon should I start to prepare for NCLEX? I'm second year now. Okay, and I'm not sure how to pronounce your name, so I'm not going to say it and butcher it. But I would say the best thing you can do to prepare for NCLEX is to study and pass your tests right now in nursing school. Don't worry about the NCLEX yet. And here's why. You have a goal in nursing school, and that is to learn the nursing content that will keep you from making mistakes and keep you safe when you practice as a nurse. But you have to work on getting that information into your head, because what the NCLEX is testing is your ability to think safely. But it assumes that you know that nursing content. And so the focus of the NCLEX exam is on you being able to think safely through a clinical situation. But in nursing school, the goal is to get as much content into your head and to understand it so that you can think safely. So there's two different goals in nursing school and then in NCLEX. So right now, your job, if you're in your second year of school, is to focus and learn that content. Because the better you learn the content, the more solid a foundation you have when you go to build your critical thinking skills on it. And that's going to be your last semester in school, and then afterwards when you're practicing with NCLEX questions. Okay? Hope that answers your question. What would you suggest as a study plan leading up to the NCLEX? 4 to 5 hours daily for a month? Material review and questions? Both? Okay, here's what I would say. Your study plan is going to be as individual as you are, okay? We don't recommend do X amount of questions 5 days a week. We don't recommend that. Why? Because everybody's life looks different. My life as an empty nester, it's just me and my husband. I don't have kids running around. I don't even have family in the area where I am in Virginia. So there's a lot of things that are different about my life that are going to be different from yours if you have 3 kids under 10, if you hold down a full-time job while you're going to school. The amount of time that you have to study every day is going to look a little different than if I was preparing to take the NCLEX. So you have to take your life responsibilities into consideration when you suggest a study plan. And you're the only one that can do that. How many hours a day do you have to study? And then you can list what you need to study. Now, what do you need to study? You have that solid foundation of content. You've got to have it. Nobody remembers everything they learned in nursing school. Do we expect you to go back and read all your textbooks again? No, we don't. But the NCLEX expects you to have a solid foundation of essential nursing content. And what I mean by essential is, what do you need to know to keep a patient safe? Okay, so for example, you don't need to know every little lab value and memorize pages upon pages of lab values. You need to know what's the ballpark, and then you need to know what is important. For example, potassium, okay? You need to know the ballpark value, 3 to 5 milliequivalents. But more importantly, you need to know, what do the signs and symptoms of hyperkalemia look like? What do signs of hypokalemia look like? Because remember, every question in NCLEX is going to be a patient situation, and so you need to be able to recognize the signs and symptoms that they give you, okay? So don't focus so much when you're reviewing content on memorizing. Focus on understanding and thinking about the big picture. That's the important in material review. And then answering questions. There's varied levels of difficulty questions, and just answering questions doesn't always guarantee success. You have to understand why you got that question wrong and how you can change your thinking to get it right. And that's more than just doing question after question after question, which is why, our courses are designed to help you to do that and to review the questions after you answer them. But that was a long answer for a short. Here's the short version. You need to review basic content. You need to practice with questions, but you need to be able to think safely. The time that it takes you to do that is totally up to you and your lifestyle. Okay? All right, let me see. Okay, somebody's asking, so this course for international students, is it a live review or is it online? Well, it's either you can purchase it online and take a course live online and then use those extra resources on your own time, or you can do the whole course self-paced. We have lots of options for our courses. And again, you can find that at kaplannursing.com, or you can call that 1-800-CAP-TEST number, and they can give you all the options for whatever you would think would work best for you. Okay, what do you recommend to someone who graduated 3 years ago to focus on in Kaplan course when studying for NCLEX exam? Okay, well, first of all, if you graduated 3 years ago, remember that old phrase, if you don't use it, you lose it? So you need do a total thorough review of your nursing school content, because if you haven't thought about it in 3 years, a lot of gaps have occurred. So that's what I would do first. I would really focus on content. If you're taking one of our courses, phase 1 of the course is all that review of essential content. We've got content videos, we've got a course book. If you're not taking our course, you go back and you look at your textbooks, and get some solid review of content before you even start thinking about taking some of the NCLEX practice questions. So content first, solid foundation. Once you have that, then add the questions. Okay? Okay, oh great. Okay, they posted about the computer adaptive test. Interested in reviewing with Kaplan online. I'm from the UK and would like to work and live in Florida. Okay, so you need to contact the Florida State Board of Nursing and decide what their procedure is. You can take the NCLEX in the UK. You just need to know what the eligibility requirements are. And remember that website I gave you, the National Council State Boards of Nursing? They have, if you don't know how to contact a certain state board, they have it right there. It's I think it's on their first page that you can, it says need to find a state board of nursing, and there's a drop down menu for all the states. Click on it, it'll take you to that state's state board of nursing. So you would want to know what their eligibility requirements are, and then you can, once you meet them, you can apply to take the NCLEX exam. You can take it in the UK, or you can take it when you're over here. Okay. And again, the good thing about our online courses is there's 2 ways you can take an online Kaplan course. You can take a live, what we call a live online class, where it's like this. It's like Facebook Live right here. There's scheduled class times. You use your computer like you're using now. You'll be in a classroom with an instructor like me. I'll be on camera. You don't have to be on camera, but you will see and hear me live time. We have a PowerPoint presentation. We do practice questions, and it's scheduled times. If there's not a time that works for you, and we have them early in the morning, we have them at night, so we try and hit all the time zones that would fit no matter where you are. But if that doesn't work for you, we also have our resources, and we have the classes pre-recorded on video, and you can do what we call a self-paced course, that you can purchase the resources and you can buy the course and then just go through it at your own rate, at your own time. All right. And the good thing about Kaplan review courses, whether it's the PN, whether it's the RN, and no matter how you take it, whether it's self-paced, live online, or in a classroom, we have a wonderful resource. And of course, I'm tooting my own horn here because I'm involved in this resource. But for students who have purchased our complete review course, we have an academic support for you throughout your use of our resources. And we give you resources that are good for 3 months, 90 days. During any of that time, when you're preparing, when you're studying, you can write to us, and we give you the email in the course, NCLEX Expert. And if you're enrolled in our course, you have free academic support for any questions you may have about the course, about a specific question, any of those things. So it's a great resource. If you do sign up for one of our courses, it's a great perk that we offer. So if you do sign up for a course and you write to NCLEX Expert, You might get me. It's me, and we have a team of people that work on NCLEX Expert, but you might get an answer back from me or one of my colleagues, and we're here to support you all through the process. Okay, Rose is about to take her PN NCLEX. Well, Rose, I hope you're ready and prepared, and know that you can do this. Because if you graduated from nursing school, you have what it takes, okay? And you know what? Not everybody graduates. Not everybody can get through a nursing program. That is difficult in and of itself, isn't it? So be confident in your ability and don't let anxiety get the best of you, all right? Because it can. So tell yourself that you are prepared, that you know how to answer these questions. You can be safe, you can be competent, and you've graduated from nursing school and you can do this. So good luck. We're going to be rooting for you. Any idea of what the test looks like? Well, the test is going to be a series of questions. Okay, they'll give you the question and the answer choices, and you're going to have to click a button. There's a little circle in front of the numbers, and you have to pick the best answer choice. And there's going to be a timer up in the corner. There's going to be a drop-down calculator. So if you have to do a calculation, you have got to use the calculator on the computer, because you're not allowed to take any food, drink, gum, hard candy, calculator, pens, pencils, nothing in the test room with you, okay? All you can take in is your ID and your body and your mind. That's all you have to work with. And so you've got to be prepared for that, okay? Okay. Yana says, thank you, Kaplan, for helping me pass my exit HESI. Next is NCLEX. Okay. So the HESI exam is an exit exam. A lot of schools use, and you're right, the next step is your NCLEX. So you are well on your way to acing that test too. Okay. Do we have to attend a class for the review? Well, it depends on what option you choose. You can attend a face-to-face class, and some students learn best that way. We also have the option of live online. You can sit in your pajamas and drink a cup of coffee and eat whatever you want while you're in class. That's the live online option. Or you can purchase the self-paced one and go at your own pace, and that way you don't have to attend class, okay? All right. How long is each class? Our PN classes are 4 hours each. They're 4 hours in the morning, 4 hours in the afternoon. That's 2 days, so 4 sessions of 4 hours each. Our RN courses are 6 hours a day for 4 days. Okay, so 3 in the morning, we take a break for lunch, an hour, and then we come back and do another 3-hour session. But of course, if you purchase the self-paced one, you can, make your own time schedule. But if you're in a live online or a ground face-to-face class, they're scheduled times. 4, 4, 4, 4, 4 sessions for the PN, 4 days, 3 hour, 3 hour, 6 hours a day for the RN. What would you recommend would help the most in relation to the NCLEX exam as far as taking the Kaplan QBank questions? Okay, I'm not sure what you mean by that. So I'm not sure what you would help the most by answering the questions. Answering the questions, whether it's the QBank or any other question, is only half of your study plan, or it should be. Okay, the other half is after you take that test, go back and review. Okay, and say to yourself, did I get this right? Did I get it right for the right reason? Because sometimes, let's face it, you just make a lucky guess. But, you know, and we can say, yay, you made a lucky guess, but that's not really helping you develop your test-taking skills, is it? If you got it wrong, you have to say to yourself, okay, here's the right answer, because the question will give you that. Why did I get it wrong? What didn't I know? And if you don't know a medication, if you don't know a disease process, you got to go look it up. That's the way you fill in the gaps of your content in the context of the questions. Okay, so again, taking question after question after question is not really helpful. You've got to go back and see what you did right, see what you did wrong. That's the best way to use any questions that you may have. Do we give classes in Stockton, or is it just an online class? Go call the 1-800-CAP-TEST or go to kaplannursing.com. It will list all the places where we offer face-to-face classes. And I said, or you can call and ask to see what classes are available in your area, if you would prefer that. And sometimes we have classes in a certain area at just certain times of year. So, you know, you have to ask customer service or look online for that information. Do you have any promotion for the review at this time? You know, I think we always are offering promotions. So again, I'm going to refer you to 1-800-CAP-TEST or our website, that they would have that. The other thing is, if you like Kaplan on Facebook or Instagram or any social media, a lot of times we post our promotions there. The other way to get a promotion is to attend a free live event. We offer live events that you can register for at kaplannursing.com. We have a little hour session on critical thinking. We have one for repeat test takers who have taken the course and or taken the test and not been successful. And when you sign up and attend one of these live events, a lot of times at the end, because to thank you for attending it, we have a promotion code at the end, so you can do that. Okay. Again, Harpreet, I'm going to refer you to either the 1-800 number or the website for the pricing, because there's all different pricing depending on all different options. You know, we have courses. We have just purchasing this CAT test. We have purchasing the Q Bank, which is just 1,600 questions that are all passing level questions. We've got tons of options for you to fit every budget and every need. So go to Kaplan Nursing and see what we have available, see what fits best for you, or call the 1-800 number. A representative will be glad to walk you through that. Okay. Okay. Charlotte says she wanted to share with the group that she's done the classroom in person and the self-paced Kaplan course. The self-paced is great if you have kids or a busy schedule. It's more flexible. You can go back and rewatch the videos, etc. Right. Okay, good recommendations. Now, I would say too that no matter what course you take, the face-to-face, the live online, the self-paced, you have access to all of those videos. So even if you take the face-to-face class, you have pre-recorded videos. You can go back and watch them again in case you forget something, you want to reinforce something. So all those resources are available to you for 90 days, regardless of self-paced, live online, or the face-to-face class. So thank you, Charlotte, for sharing that. Okay. Ronnie says, can you teach me about decision tree making? I can if you sign up for a course. That's one of the things that we teach to practical nurses and registered nurses as part of our complete review course. So we don't share that with everybody, but if you're willing to pay for our complete review course, that's one thing we teach you. It's a framework for thinking that will really help you. Our students say that that made the difference in their taking the exam. So sure, Ronnie, we'll teach it to you. Sign up for a course and we'd be happy to do that. Okay. Okay, how long have I been working with candidates for the NCLEX? About 10 years. Okay, so I have seen a lot. I've seen a lot of students. I've taught a lot of students. I've worked with a lot of students through NCLEX Expert. I've worked with a lot of students who have been unsuccessful with the exam, but then came back to be successful. So thanks for that question. A lot of us here at Kaplan, we love our job. We love helping students, and we kind of been around for a while. And we want to help you succeed. Because nursing has been such a rewarding career for us, we want you to have that same reward. Okay. Okay, I see that we posted that we currently have a promotion for the computer adaptive test for another couple weeks. You can receive 30% off, and they put the link in there. And as I said, if you want a discount on the courses, the full complete review course, you can sign up on kaplannursing.com, attend one of our free events, and they always give a $50 to $75 promotion off just for attending the event. Okay, let me see if I missed any. Anybody else have any questions? Okay, when is the next free live event? I don't know. Go to kaplannursing.com or call 1-800 and they can tell you what events are there and when they're going to be. Okay? Okay. Let me talk a little bit about what you can and can't take with you on test day, because that's something that a lot of students don't think about, and then when they get there, it throws them off their game. So as I mentioned before, you can't have food or drink in the test room. You can't chew gum. You can't suck on hard candy. You can't wear a watch. There's clothing restrictions. There's a video camera that's on you all the time. So it's good to know that ahead of time so that when you're practicing, you don't sit there with a bag of chips and a bottle of Coke, because you get into habits when you do that. So when you're studying, you want to really practice the way it's going to be on test day so that it's not different for you, because you're going to be restricted. And most of us don't study without something to eat or drink or whatever. The calculator thing is a big thing for students because you're so used to using your phone. Well, you're not going to have your phone in there, are you? And so you have to use that one on the computer if you are one of our Kaplan students. But that's something that if you don't take a Kaplan course, you need to be aware of, because it's a lot of students say it's just a pain in the neck to use a drop-down calculator on the computer because you're so used to using your phone. But again, beware, you cannot take your phone, you cannot take a handheld calculator or a phone into the room, okay? Okay, Violet, that is a great question. Violet says, do I have any advice for test anxiety? I do. And you know what? Everybody is going to have some degree of test anxiety. Because let's face it, this test can make a big difference in the rest of your life. It's one of those milestone things, right? And so you know you have a lot riding on this. So the first thing to do is be proactive. Know that anxiety is going to be a problem. So what are you going to do during your preparation to help you control that? Because it's a given that it's going to be there. You know, some people are going to have it to a higher degree, but it's going to be there. So you need to practice what you're going to do. If you say, when I get anxious on test day, I'm going to take deep breaths, I'm going to close my eyes. You know what's going to happen if you don't practice it and make it a habit? You're not going to do it because you're just going to be so unfocused that you're not going to be able to think enough to do it. So build those anxiety reducers into your practice. It sounds silly, but trust me. Talk to somebody who has failed the exam and they will tell you how important that is. Okay? So know it's going to happen and recognize what your physical signs of anxiety are. And maybe it's not in relation to taking a test, but just think about life in general. When you get anxious, what happens? Do you get nauseated? Does your heart rate speed up? Do you get short of breath? What are your particular physical signs that you're saying, my anxiety is on its way up? Recognize those. We don't even think about it a lot of times. Take the time to think about it, because when you're studying and on test day, when those symptoms rear their ugly head, that's a sign I need to do something about my anxiety before it's out of control. Okay? Some people taking deep breaths, closing their eyes, that works to just bring them back down. You know what a great anxiety reducer is? Adequate preparation. If you don't study and you go in there, of course you're going to be anxious because you didn't prepare properly. So make sure that you have a plan, a study plan for the NCLEX. Stick to it, whatever that plan is, and make sure that you are prepared and confident when you go in to take that test. Okay? Some people have test anxiety. Some people need to be on meds. You've done it through nursing school. Don't think that if you have been on a medication to control test anxiety all through nursing school that you're not going to need it on NCLEX day. That's not the case, okay? You have to do what you have done to control that anxiety in nursing school. You're going to do the same thing at NCLEX, because that anxiety is not going to be decreased. It's going to be notched up. Okay, and so you have to recognize that and be proactive about it and decide how you're going to deal with it. Some students love to just have a positive thing that they say. I'd say, I'm doing great, I'm doing great, I'm getting through this test. You know, whatever it takes for you to have a positive attitude and to decrease your anxiety, it's going to be key because mental attitude is a key. Okay? Kaplan classes don't work for me both online and live. Okay, but you could do the self-paced one if you wanted to. Okay, because that way you purchase the product, you get the videos, you get the questions, and you work at your own pace. So that's a possibility. When you sign up for the self-paced course, you also get the academic support. at NCLEX Expert. So we have a lot of students that have taken the self-paced course that we still have that academic support that you can write to for questions. Okay? Okay. Whoever is doing the posting, I'm sure they saw, who is it here? Somebody said post the link to the promotion. I think they already did. The promotion for the cat. Okay, I think they already posted that, but I'm sure they will. Okay. Well, it looks like we have answered all the questions here that I can see. If I missed one, let me know. Before we wrap things up, any last questions? Okay, there they posted it again. So that promotion for the computer adaptive test is there. What is a great motivation to study for your RN NCLEX? You know what I think the best motivation is? Print your name on an 8.5 by 11 piece of paper, like on your computer, and put RN after it. Your name with RN after it. Print it out, decorate it if you want to, but post it where you study, because that's your goal. And anything that is worth having is worth working for, isn't it? So post that, your name with RN after it, big, where you can see it. And when you get frustrated and don't want to, and you want to go out for coffee or something with your friends instead of studying, I want you to look at that name and say, that is why I'm doing this. All right? That is a big motivator. Keep your goal always in front of you, and it's a big motivator. I want that, and I'm going to do what I need to do to get it. Okay. Any tips for NCLEX retaker? Okay. Well, if you took our course, our complete review course, we have a special seminar for those students, and you can write us at NCLEX at Expert and let us know that you have taken that review course, that you didn't pass the first time. We can get you involved in that seminar. If you're a repeat test taker and you haven't taken our course, well, I would suggest maybe you should take it because it's a good course. But if that's not an option for you, then we also have a free event. One of our free events is tips for repeat test takers. Okay, and it's free. I think it's an hour or an hour and a half long, and you might get some tips with that. Okay, so the one thing about Kaplan is we know your needs, we know nursing students, and we have a wide variety of resources for you to use. There's something for everybody in our resources. Okay, you took the review course, yeah. Okay, so then you can write your academic support, and we can get you enrolled in our repeat test takers workshop seminar. Okay, so maybe you'd want to do that. Okay. The one for students who have taken our complete course, that workshop is only available to those students, and you have to write to your academic support, and we can get you started on that. That's not open to everyone, but we do have that that free one. So we do have that. How many weeks do we need to be prepared for NCLEX? D, that's totally up to you. Okay, you need, again, a solid foundation of content. So if you have some content gaps, you have weak areas, and let's face it, we all do. When we graduate from nursing school, you know what they are. What are your weakest areas? You need to work on preparing and shoring up those weak areas, because you know what, you're going to need a solid foundation in all the areas of nursing that you studied in school, and that's very individual. But you need to review your weak areas and shore them up first. Then you need to practice your thinking by answering NCLEX style questions. Okay? But everything starts with that solid foundation of content. Okay, so again, D, it's going to depend on how much content review you need, about how much time daily that you have to devote to studying, what your other life obligations are. So it's a very individual thing. Okay, and it really depends on where you are in your life, and what obligations you have, and how much time you have to devote. Now, if you don't have a lot of time, then it's just going to take longer for you to prepare to take the test. Take the time that you need. All right, let me throw out a statistic here. Okay. A lot of students, when they graduate from nursing school, they just want to get it over with, and so they want to test immediately. Don't do it. Be adequately prepared, because the repeat test taker rate for people who take the test once and then they don't pass it and have to take it again, it's less than 50% of those people that pass. So you want to do it, and you want to do it right the first time so you don't have to do it again. Because not only do you have to deal with the test and the thinking and all that again, you have to deal with your psychological problems when you feel like you can't do it because you failed once. Okay, so take the time to prepare adequately the first time, ace it, and move on with your life. All right, don't rush it. Is the TOEFL really helpful for foreign trained nurses to take NCLEX? Again, I don't know that much about that exam, but I will tell you this. A lot of foreign nurses, if they don't have a good grasp of English, the NCLEX is very, very difficult for them. The way that the NCLEX questions are designed and are worded, it's hard for students that are educated in the United States. So if you do not have a good command of the English language, you need to work on that first. That is my suggestion as a person who has worked for 10 years with students that English is their second language. Okay, I hope that helps. Okay, Tamara says, I did the review classes. Do you mean the Kaplan course? Now I'm home waiting for my ticket to test, and I can't seem to get adjusted to not having school. Ugh. Okay, should I study like I'm still back in school, and after I pass, then get back integrated into regular life? Okay, Tamara, again, what did your school days look like? I mean, did you forget the rest of your life and just study, class, school, whatever? I think there's probably a happy medium in there. Carve out a time to study every day. Consistency is a really big factor when you're preparing for the NCLEX. You don't want to wait, but you also don't want to just complete everything and then do nothing, and sit and twiddle your thumbs waiting for your test date to come. You want to do a little bit at a time. I have heard no student ever say, I spent too much time reviewing nursing content. I've never heard a student say that. Okay, so there are always things to go back and review. You can always get better at remembering things, at understanding things. So I wouldn't go as far as studying like you're still back in school, but I would schedule studying like you schedule everything else in your life, and then leave a room for a little bit of relaxation and fun. How does that sound? That would be my plan. Okay, when can I know I am ready for the test? That's a great question. If you take one of our courses, we tell you when you're ready based on how you're doing with the testing and the resources. For somebody who's not taking a review course, I would say, are you comfortable with the thinking you need? Are you understanding the questions? Are you understanding why the right answers are right? If you don't have a clue why you're getting things wrong and you don't recognize the patterns of your test taking, then you're not ready to test. Okay, so again, it's that self-evaluation, that self-reflection piece that really is the key to success in taking this NCLEX. Not just taking question after question after question and not realizing what you're doing wrong. Of course, if you need help figuring out what you're doing wrong, that's what we do in our complete review courses. We teach you how to be a better test taker in general, as well as preparing for the NCLEX exam. Okay, Mylene, again, I don't know if we have a live review in the Seattle area, but call 1-800-CAP-TEST or go to kaplannursing.com, and there's a list there and you can find that out. All right. Charla says, as a nurse that has been out of the workforce for 5 years, Kaplan without a doubt was essential to NCLEX success. Well, thank you for that. We are glad that you are an RN and you've been out in the workforce for 5 years and that Kaplan helped you. Okay. Do we have any last minute questions? We're just about to wrap it up. Okay. Can the NCLEX prepare you to work in Canada too? Yeah. Okay. Anybody in North America takes this test. Okay. Now you mean if you're in the United States, can you go up and work in Canada? Again, it's the same thing as, remember I said you have to look at the Board of Nursing in the particular state. Canada has something similar, and it's regional provinces is what they call it, and it's just like a state. So you have to go to the province that you would like to work in, even as a United States citizen, and find out the eligibility and the requirements for that. But everybody in Canada and the United States takes the same test. Okay, so it depends on your Board of Nursing or, and I forget what they call it in Canada, provincial college or something like that. You probably know. Denise, maybe if you live in Canada. But it's the same thing as going state to state. The provinces are going to have a little bit different qualifications, so you need to go right to that site in order to find out that specific information. All right, I think we are about ready to wrap things up. Thank you for joining me tonight. I hope it was helpful for you. I would love to see some of you in one of our Kaplan classes, but however you prepare for the NCLEX, study hard and your hard work will pay off. Best success to you, future nurses. Thanks again.